Welcome to Medication Administration Training, and thank you for coming today. We know your time is very valuable and we do appreciate you attending today's presentation. Just so that you know, the presentation will take about 30 minutes. Now you're probably thinking, why do I have to take medication administration training when we have someone else here at the school that's already been trained and assigned that responsibility? That's a good question. The law requires that you receive medication administration training if you're going to be giving medication during the school year. Who may need to receive medication administration training? Well, certainly health room staff and substitutes, and teachers for field trips, coaches for athletic events, and possibly bus drivers for emergency medications. Anyone who may be responsible for giving medications to students. Our objectives today are to teach you, number one, why and when you may be giving medications. Number two, how to give medications properly. And number three, emergency or rescue medication usage. And number four, field trip medication administration. Deborah?
Thank you, Roxanne. Because medical emergencies can happen any place and any time, staff and faculty members should be able to recognize medical emergencies requiring rescue medication such as inhalers and EpiPens. We'll be covering that later in the video. Additionally, any staff principally responsible for students needing special medical assistance or treatments may need to receive child-specific training by a registered nurse. To illustrate what you should know in order to administer routine and emergency medications, we've prepared several brief scenarios. After viewing this training video, please download, read, sign, and date the training completion form and then turn it in to the health room staff. This will be the only record of medication administration training on file. If requested, the principal will be forwarded a copy of documentation from the health room staff. You could think of annual medication administration training as the new tradition for the beginning of each new school year. This video will be available for annual retraining. This CD also contains documents which you may want to download. These documents will be mentioned later in the video. We understand that not every school has a nurse on staff. However, your principal has designated someone at your school to give medications. Please note that in this video, the narrator will be referring to the person giving medications as the nurse.
What does the law say? We are guided by Section 1006.062 of Florida Statute, Title 48, Education, Administration of Medication by School District Personnel. A summary of the statute section is as follows. School district personnel are authorized to give medication if, number one, they have been trained by an RN, an LPN, a physician, or physician assistant according to the school district's school health services plan. Number two, the school district's medication authorization form has been properly filled out by the parent or the guardian. And number three, medication has been received in its original container, its contents counted, and medication stored and administered directly to the student directly from its original container. The first dose of medication must always be given at home. The medication must be stored in a secure fashion, such as in a locked cabinet. There are other sections of this statute concerning students with asthma and who require more medically complex procedures. These areas will be discussed later in the program. You may be wondering, what is my liability? According to Florida Statute 1006.062, Administration of Medication by School District Personnel, there shall be no liability for civil damages as a result of the administration of medication when the person administering the medication acts as an ordinarily reasonably prudent person would have acted under the same or similar circumstances. Now let's learn some basic standards of medication administration.
The basic standards of medication begin with the 6 rights of medication administration. Number 1, the right student. Number 2, the right medication. Number 3, the right dosage. Number 4, the right time. Number 5, the right route. And number 6, the right documentation. It is very important that you remember all 6 of these rights of medication administration. Another important aspect of giving medication is to wash your hands before handling medications. Let's take a look at a few examples of the wrong ways and then the right way to give medication.
Hi.
My name is Mary.
Hi. One moment. There you go.
Why did I take this?
Well, your mom brought it in this morning and said give it to Mary Smith when she comes in.
But I'm Mary Thomas, and I came here because I have a splinter.
What went wrong? The nurse should have asked the student for her whole name. Also, the nurse should have asked the student for the reason that she came into the health room in the first place.
It's going to be at 4 o'clock. We're going to have hamburgers and hot dogs and chips, but I just haven't gotten any birthday presents right now. Hang on just a second. Good morning, Billy. I'm a little bit busy right now. Do you think maybe you could go ahead and get your medicine out of the cabinet? You know which bottle it's in. There you go. They're all the same. And then I'll check it later. Just go ahead and put the bottle back up in the cabinet and I'll sign it off. Thank you. So, anyway, as I was saying,
What went wrong? The nurse didn't give the student her full attention. She didn't ask his name. She didn't check all 6 medication rights. And she actually gave Billy full access to all medications and more.
Okay, Jane, well, let's go ahead and give you your medicine. Let's see, you're supposed to get 1 teaspoon of this penicillin. Oops. Open up. Yummy. I didn't get you quite enough, so I'm going to give you some more. There you go.
What went wrong? Don't give medication until you are sure that you have the correct and complete dosage. Use only the appropriate liquid medication administration devices, such as a plastic medication cup. When giving medication with cups of water, always use disposable cups. You don't want to pass disease from one person to the next.
Sam comes to the health room every day at noon for his medication, which he takes at 8 a.m., 12 noon, 4 p.m., and 8 p.m. Today he comes to the health room at 9:30 for a scrape on his hand he received during PE class.
Hi, Sam. What happened?
Hurt my head.
You hurt your hand at PE class. Let me see. Goodness, let's get it washed off over here. You did a real good job on that. Did you hurt the equipment or just your hand? Just your hand. Well, what if you think we go ahead and give you your medication right now, and that'll save you another trip to the health room today. Then you won't have to be coming out of class again. What do you think about that?
What went wrong? The nurse wanted to give Sam his medications 2.5 hours early. Medication should be taken on time, but it's fine to take medication up to 30 minutes before or up to 30 minutes after the time the medication is due. If you're unable to give the medication within these guidelines, please check with the parent before proceeding.
Brianna has an ear infection. This morning, her mother brought eardrops into the health room.
Hi, Brianna.
Hi. My eyes are turning really red.
Okay, well, your mom brought in some eye drops for you today. So if you'd like to lay down here, I'll get them. Alrighty, look up at the ceiling.
What went wrong? The nurse obviously wasn't paying much attention when Brianna's mother brought in eardrops instead of eye drops. She didn't check the bottle label and the reason for the medication.
Now the phone. Hello? Yes. Yes, I'm still working on the information. I'm so sorry. I'm bogged down. My computer's not working right now. Yes, yes, ma'am. I'll get back with you as soon as possible. Oh my goodness. How am I going to get everything done? I know. I'll go ahead and sign off the medications for the whole week. I just hope I can remember if each student came and what time they came, but I have a pretty good memory. I think I can do that.
What went wrong? Document medication only after it's been given, never before it's been given. Now, let's take a look at the right way to give medication.
Good morning. Good morning. Well, I think I know who you are, but would you tell me your names?
Tommy and Robbie.
Okay, but I think I need to know your name. Will you tell me what your name is?
Robbie Hancock.
Robbie Hancock. And you are?
Tommy Compton.
Tommy Compton. Okay. Robbie, I'm going to ask you to sit over here for a minute. And I'm going to take care of Tommy, and then I'm going to come back and take care of you, all right? Okay, very good. So wash my hands, and I'll be right with you. Just get in this cabinet and unlock it. Let's see. Tommy Compton. And here's Tommy. Might be, that's not right. Tommy Compton. Okay. Let's read. One pill at 9 o'clock a.m. Okay, it's 8:50. We're good to go. There's some water for you. Okay, did you swallow it?
Yes.
Very good. Okay. Just document the medication here. Very good. Okay. I'll take that. And you can have a seat. And Robbie, you come this way.
Great job. As you have seen, there are wrong ways and there are right ways to administer medication. Please remember to follow the 6 rights of medication administration. Now, let's take a look at a couple of commonly used emergency medications, inhalers and EpiPens.
Inhalers are used for the treatment of asthma. Asthma is a disease which causes the airways of the lungs to become inflamed, resulting in swelling and blockage. As a result, there is increased difficulty in breathing. An asthma attack can be life-threatening if not treated promptly and properly. Asthma attacks can be mild or severe. They may develop suddenly or more slowly. Symptoms of an asthma attack may include shortness of breath, coughing, wheezing, and pain or tightness in the chest. Inhalation is usually the most effective method of delivering medication to treat asthma. The medication goes directly to the lungs where it can begin to relieve symptoms within minutes. There are many different kinds of inhalers and various methods of delivery. Rosie is going to demonstrate the use of one of the inhalers more frequently used in the school setting, but keep in mind that others are also used. Be sure to familiarize yourself with the system your student is using, and always follow the instructions on the individual student's asthma action plan. We will break down the procedure for using an inhaler and then elaborate on some of the steps. Then Rosie will go through the entire procedure, demonstrating the correct sequence and timing. Remove the inhaler cap. Hold the inhaler upright and shake. Tilt the head back slightly and exhale completely. The inhaler should then be positioned in one of the following ways: either in the mouth, or 1 inch away from the open mouth, or in the spacer if one is provided. After correct positioning, press down on the inhaler to release the medication while at the same time breathing in slowly through the mouth for about 3 to 5 seconds. Hold the breath for 10 seconds while keeping the mouth closed. This will allow the medicine to reach deeply into the lungs. If a second dose is ordered, wait for a full minute and then repeat the procedure. Now the complete sequence. After using the inhaler, if the student fails to improve, or if any of the following symptoms are present, get emergency help by calling 911. The signs indicating additional help is needed include the student hunched over with shoulders lifted and straining to breathe. This position is done in an attempt to make breathing easier. Other indications that the student needs additional help include difficulty completing a sentence without pausing frequently for a breath, or bluish appearance of the lips and our fingernails, which indicates a lack of oxygen. Anaphylaxis is a sudden, severe, and potentially fatal allergic reaction. Symptoms can occur within minutes or up to 2 hours after contact with the allergy-causing substance. Anaphylaxis is most commonly triggered by foods including peanuts and other nuts, shellfish, milk, eggs, and some food additives, or by insect stings, by yellow jackets, hornets, wasps, and fire ants, by medications, particularly antibiotics, and by latex, which can be found in elastic waistbands, balloons, and many other commonplace items. Sometimes the cause of anaphylaxis is not known. An anaphylactic reaction may begin with a tingling sensation, itching, or a metallic taste in the mouth. Other symptoms may include hives, a sensation of warmth, redness to the face and neck, asthma-like symptoms, swelling of the mouth and throat area, a high-pitched voice, difficulty breathing, vomiting, diarrhea, cramping, and loss of consciousness. Benadryl may be ordered for mild allergic reactions, but epinephrine, delivered via EpiPen, is the drug of choice for treating a severe anaphylactic reaction. It is important to administer the EpiPen as soon as a severe allergic reaction is detected. And anytime EpiPen is used, it is a medical emergency and 911 must be called. To use the EpiPen, remove the EpiPen auto-injector from its storage tube. Make a fist around the auto-injector with the black tip facing down. With your other hand, pull off the gray safety cap. Hold the black tip near the outer thigh. Do not put your thumb over the end of the unit. With a quick motion, swing and jab the auto-injector firmly against the thigh at a 90-degree angle. This will release a spring-activated mechanism that injects the epinephrine. Hold firmly in place a few seconds after activation. Then remove the auto-injector from the thigh and massage injection area for several seconds. Check the black tip. If the needle is exposed, the dose was given. If not, repeat the injection. Carefully bend the needle back against a hard surface. Place the used auto-injector, needle first, into the plastic carrying case. You can discard the gray cap. Recap the tube and send with the student to the hospital. The EpiPen must be used only on the thigh. Do not inject in the arm or the buttock or anywhere other than the thigh. And it is not necessary to remove clothing. Inject directly through clothes.
You may need special training for additional emergency medications such as glucagon for low blood sugar and Diastat gel for seizures. If it is determined that you need to receive child-specific training for specific medications or for special procedures, such as blood glucose monitoring, you may receive such training by a registered nurse. Please check with your health room staff for further information. Now, let's take a look at preparing medications for a field trip.
Hi Sandy, do you have my students' medications ready for the field trip today?
I do have everything you will need, but first, did you know that the Florida statute states that all persons giving medications must have medication administration training first? This training requirement may include nurses, secretaries, health room assistants, teachers, substitute nurses, coaches, and even bus drivers.
No, I had no idea. When and how am I supposed to get this training?
Well, you can receive the general medication administration training by viewing this video where you'll learn the 6 rights of medication administration. In addition, non-medical personnel will receive child-specific instructions from a registered nurse before performing services such as monitoring blood glucose.
Again, I had no idea. This sounds so complicated.
I know it does, but it really isn't. Let me say it another way. If you have a student who has diabetes, an RN will teach you signs and symptoms of low blood glucose, how to use the finger stick equipment, and other pertinent issues you may need to know. Oh yes, remember that always, including while on field trips, all medications must be kept in a locked, secure container. This could be a tackle box or even a bank bag, both with keys. You probably have figured out that these will need to be secured at all times and must not leave your possession. And with all your medications that you will need, I have a first aid kit for the trip.
So let me get this straight. Every time I go on a field trip, I need to be trained on the same students' special needs again?
No, not at all. If you have been previously trained, then you won't need to have a repeat training unless you have questions. However, each time you have a new medication or procedure for a student, you will need to have the child-specific training on each of those medications or procedures.
Do I have to take the entire bottle of medicine filled with me, or are there other alternatives?
Well, that's a good question. Any pharmacy where the medication was filled can make an extra bottle with the entire label on it, but the medicine must be properly labeled, and a parent or pharmacist must place the correct medication in the bottle or we can't accept it for the field trip. Lastly, remember that when you return to the school, make sure that the documentation is complete and that you have returned all materials to me or your health room designee before going home today. When you use the first aid kit supplies, including the disposable gloves, please let me know and I will replace them so the next teacher that will use the kit will have all the necessary supplies that they may need. Okay?
Oh, definitely. Thanks so much, Sandy.
As previously mentioned, you must receive and document medication administration training before assisting a student with their medication. Please contact your health room staff or refer to the school health manual if you have further questions regarding administering medications. The forms and documents which are available either by download or in your health room are School District Medication Administration Form MIS 5183, School District Off-Campus Activity Permission Form MIS 5185, Field Trip Policy Information and Suggestions for First Aid Supplies, and Medication Administration Training Documentation Form. You can find the Florida statutes online by going to www.flsenate.gov, then search the statutes.
Please remember, your goal and our goal is the same: to administer student medications in the safest possible manner. Please remember to turn in your training form to your health room staff.
Thank
you all for spending time with us.